What's up, everybody? This is Dr. Zach Baker of Rehab to Perform and RTP Academy. You are listening to the Strength and Knowledge Podcast. And with us today, we have Dr. Seth Hawks, who is one of our sports residents and physical therapist here at Rehab to Perform. And Seth is wrapping up the final month of his sports residency here. And today he's going to talk with us about the two final journal articles that he did as part of his research article review for us. One being ACL related, the other one being an updated guidelines from NATA in regards to sickle cell and how that is handled and how that is managed. So Seth, hard to believe that we're coming down to the end of residency, but do you mind, we'll start off with the ACL article. Can you talk to us about what was the article that you found and really why it was interesting to you?
Yeah, so the article that I found regarding ACL is talking on the psychosocial readiness, psychological readiness questionnaires that we use and all of that, and how those correlate between the athletes that do go back to their sport after rehab and the ones that don't. And so it was more of a systematic review and meta-analysis going off of, I think it was 17 different articles. But the real big reason they wanted to look at this is really to see if there is truly a difference on that psychological readiness, and if that is, inadvertently causing a lot of people not to return solely because it's not getting addressed properly. So really with this, like I said, they took 17 different research articles that looked through the ACL return to sport scale, the knee self-efficacy scale, the TAMP scale of kinesiophobia, and the international knee documentation score. And they looked at clinical metrics on top of that as well from their sessions. Ran those through a couple different systems, made sure that it was methodological, and that the mean difference was clinically relevant for them. So out of all of the athletes they had, 61% of them returned to their sports. The rest of them, unfortunately, did not. And when they really kind of looked at the numbers, there was a significantly higher report for the ACL RSI and the cases. So both of those showed that the ones that went back into their sport definitely seemed more psychologically ready from those tests. And then they had a significantly lower score on the TSK, so showing same thing, that they felt more prepared, more ready to get back out there. There's really no difference with the IKDC, but really just this kind of just touches on how important some of the psychological side truly can be to get back into what you like doing.
Absolutely, and I think we've done a really good job within the field of not only paying attention to time frames that it's taking for people to return to sport and making sure that we're returning them in what's traditionally an acceptable time frame. If you have an ACL injury, typically 9 months or greater is what the universally accepted time frame is. And if you're doing something prior to that, there better be some sort of sense of urgency, some sort of clinical reasoning, or some sort of situation that warrants it. And you just appreciate that statistically, you're at an increased risk of re-injury. So I think we've known that, and we've stuck to that pretty well. Then, over the last 5 to 10 years, I think we've seen very good improvements with regards to monitoring physical readiness. And not only have they reached a certain threshold from a time standpoint, but are they passing certain functional tests? And we can argue over what's the most relevant functional test, but at least we're tracking and we're consistently looking at this at discharge. And we're not only looking at timelines, but also criteria for return to sport readiness. This is kind of that next piece of the puzzle, and making sure that they're not only physically ready, but mentally ready as well. And for those unaware, the TSK, the IKDC, they are subjective questionnaires that look at that, and they're looking at the individual's perception of how they're doing and how ready and confident they feel with regards to their knee function and their ability to play within a sport. Going through this article, Seth, and honestly just going through your year of residency with us, what are your big takeaways either from the article, or what are things that you're more mindful of now when you're having conversations with individuals following ACL surgery who are preparing to return to sport?
So one of the big things is when progressing plyometrics, when progressing all the locomotor movements, getting into like faster jog paces towards that borderline sprinting and all of that, they can show that they can do it, but you don't know if they truly feel comfortable doing it, if they feel like it's too risky or anything. Some people will show you just by making compensations and things like that. But, you have some kids that they don't like to talk about their feelings. So they're not going to tell you if they are worried on this motion, and they're just going to do it because you told them to. And so a big thing that I always try to keep in mind, even before reading this, is that I'm treating the patient, not their injury, not what they're there for, post-op, anything like that. That I'm treating the entire person. So like really taking into account that biopsychosocial aspect of so many other aspects can play a part in their functional ability, their mental ability. And if it's not getting addressed properly, then you do have a higher chance that they won't get to go back to doing what they like doing because they're scared to.
And I think the beauty of being a physical therapist is you get to spend a lot of time with individuals, both within a session, but over the course of a plan of care as well. And things to be mindful of as a clinician is, what is this individual's baseline? When you saw them day one, what did they present like? And then how have they evolved, or how have they remained consistent throughout that process? Being mindful of changes in behavior, either things that you are noting, or especially if you're working with youth, adolescent individuals, what is their parents, their coaches, their teammates? Are you getting any clues from them that this person's acting out of the ordinary? Also, as you progress through a plan of care, do you see differences in confidence level as they're doing things within the clinic versus doing things outside of the clinic, either as just part of a home exercise program or transitioning back into sport? And maybe you had somebody that was extremely joyful, extremely bubbly, extremely confident. Then you get 6 or 7 months out and they start getting involved in practice again in modified conditions. And you start to see this really extroverted person who is very confident. They start to pull back a little bit. And maybe as they're crossing that threshold into getting back into their sport, they realize, I'm not as ready as I thought I was. Or they think they're not ready, and you need to validate those concerns for them. So I think being mindful of what is this individual's natural disposition, which you'll pick up on that throughout the course of their care. You'll also pick up on that on cues from how they interact with their their parents, their friends, other individuals, and then seeing what are changes that are happening. If you see significant changes, or if you see significant things that are out of the ordinary, or they don't match up objectively and subjectively, that may be a cue for us to refer out or provide them with resources on what are different personnel, either within the medical field or the health field, that we can present them to that may help them work through some of these different things. Seth, before we get into the other article, any other final thoughts on ACL rehab and what was brought to light in this article?
Like I said, when going through the progressions, and for an example, one of my ACL patients were working on single leg bounds and working on that harder single leg deceleration. And they've always been very extroverted, very present while they're there. And I could tell they just kind of were shutting down a little bit the other day. And so I just took the time to stop and say, hey, I can tell that you're nervous on this. What could we do to make you feel more confident so we can work on this and get the most out of it? So taking the time to get their feedback on it to try to help build their confidence in a way that then should actually target how they need to be perceived for that.
All right, now let's shift gears a little bit, and we'll go into the next article, which is really more of updated guidelines, position statement. But can you talk a little bit about what the article brought to light and what the article was in general?
Yeah, so it was straight from NATA. It's their consensus statement for sickle cell trait and the athlete. So really, this just kind of goes into guidelines of what to look for, how to go about treating it, and then what to do in an emergency situation for it. Because there's a lot of aspects of sickle cell that we have good understanding of, being of the cardiovascular conditions, the hypothermia, things that can happen and all of that. But really one of the things that we don't have the best understanding on as a whole, like PTs, ATs all combined, is the more of the like acute exertional rhabdomyolysis that can happen. That's really where you can get a lot of the like big issues that can lead into that, like essentially like sudden athletic death. And so this is just trying to go through like what to look for to see if that is starting to occur, if we're getting some of that sickle cell symptoms coming in, things like that. And then how to kind of differentiate that from more of a like heat stroke type situation as compared to sickle cell.
And were there any big markers with that, or big characteristics or symptoms that it noted to be able to make those differentiations?
So typically if like sickling is occurring, there's not like heat cramp type symptoms that happen. The heat cramp pain is way more excruciating. With the like physical findings, heat crampers, they're going to yell in pain. You're going to tell that they're cramping up essentially. But people that are sickling, they lie fairly still. They're not yelling in pain. Muscles look and feel normal. You can't visually or palpation wise tell if there's any cramping, anything like that. And with sickling players, if it's called early and treated right, they recover way faster than players with like a major heat cramp going on.
And then in regards to prevention or just putting people in the best position for success, did they have any guidelines? If you have somebody that is identified as having this trait, are there things that the athletic training staff, physical therapists, medical staff should be aware of, or accommodations to make from a practice standpoint, from an acclimation to activity standpoint? What are some special things that we should keep in mind for somebody with sickle cell compared to the rest of the team?
One of the big things of that is that it should be like a slow build-up for practices, for lifting. Most of the times that any type of like sickling emergencies that have happened with athletes, it's been more with fast-paced sprints, not being ramped into it being more of quick warm-up, and then we're doing 40-yard dash today. And so that's really a big part to take into account. And then along with that, really encouraging like a very solid preseason strength and conditioning program for it to enhance that preparedness for the testing. That'll be more sport-specific. With that, any type of symptoms that you notice, they should immediately get pulled at that point for at least the rest of that day. And, if you do see more of the emergent symptoms, they need to be, like, you need to activate your emergency plan and have them checked out, because that can very quickly turn into a life or death situation.
And I think the big message with that is knowing what the emergency action plan is. And part of that comes down to the environment and the setting that you're in. If you're in a collegiate or a professional environment, you more than likely have athletic trainers on staff. You probably have somebody covering the game in addition to the athletic trainers from a medical standpoint. You have the personnel on staff that can recognize those risk factors and the evolution of that condition, make the appropriate determination of, can we handle this in-house, or is this a more emergency situation and we need to get them into an emergency room or somewhere along those lines. And you have readily accessible means to do that. You probably have paramedics on site. You have transportation that's easily accessible. This gets a little bit more tricky when you're not in that structured environment. If you're in a high school environment where maybe you don't even have an athletic trainer at the game, or if you're an individual that doesn't participate in a team sport and maybe you're just exercising on your own. And I think this is where public awareness and recognition of what are your emergency traits, what is the plan of action if something were to happen, and how are we carrying that out, makes that important. And for those who are listening, we'll provide a link to the article in the show notes so that you can get a more detailed description of this. But Seth, with regards to the sickle cell article, anything else that's top of mind or something that you think would be beneficial to touch on before we wrap up?
So really big things on this one is, if you have a patient that's coming in and you do see on their medical history that they have been diagnosed with sickle cell, then take into that account of they definitely need a proper warm-up. We shouldn't do a quick warm-up and go straight into like very fast-paced exercises or like progressions. So at that point, even just like giving them a very, very structured, longer duration warm-up to hit, like even before they come in the clinic at that point. So the big thing is just, even though it is a smaller percentage of athletes that you see with this versus other like medical conditions on average, it's still important to know where do I need to change things to make sure that we are going about everything properly and not putting them at risk for any type of sickle collapse.
Seth, as always, thank you for the information. Thank you for doing the dirty work, going through the literature. If you liked this episode, please share, like, and subscribe, and stay tuned next time for the Strength and Knowledge Podcast.